Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Lindsay Seefeldt, a doctor of physical therapy who specializes in oncology rehab and lymphatic services. Lindsay is the owner of Uplifted Oncology Rehab in Green Bay, Wisconsin, and she brings a wealth of knowledge and expertise to her practice. She's a PORI-certified comprehensive oncology rehabilitation specialist, meaning she's specially trained to support cancer patients at any stage, whether they're newly diagnosed, going through treatment, or entering post-treatment survivorship. But that's not all. Lindsay is also a certified lymphedema therapist, helping those with lymphatic concerns and lymphedema find relief and regain their strength. We're so excited to have Lindsay on the podcast today to talk about how she's helping people heal and thrive after a cancer diagnosis, as well as what we can do now for cancer prevention. Let's dive in.
Hey guys, welcome back to the podcast. We're super excited to have Dr. Lindsay back here. We had an awesome conversation in the last episode talking about bras and breast health. That was absolutely fabulous. If you guys did not listen to that, or the first episode talking all about oncology rehab, that was also excellent. So make sure you guys go back and check those out. But in this episode, we're going to be talking about our lymphatic system. So we did touch about those in those other 2 episodes, but this one we're really going to dive into it, and I'm really excited for this conversation. So let's just start basic. What is the lymphatic system and why is it so important to our overall health?
Yeah, I'm such a geek with this topic. I've been doing lymphatic work over 10 years, so I really know the lymphatic system well. And it's a system I think people don't really understand the importance of, but this is our powerhouse. This is where our body maintains things. This is where our body fights diseases and infections. So our lymphatic system is head to toe. It is just like our vascular system. So if you can imagine, all the veins and everything that travels everywhere, our lymphatic system very much mirrors that. It webs all the way through everything. And so, it's in our skin, it's in our, like around our muscle tissue, it's deep in our gut system. It's everywhere. And so what our lymphatic system does is there's a few things. Number one, it maintains the water balance between all of our tissues. So, we need to have, our cells nice and plump and healthy. And so our lymphatic system will help pull in good fluids. It'll take all the cellular debris out of the cell. So there's this constant exchange for healthy and bad. So that is what our lymphatic system will do there. The second thing is this is where we fight diseases and infections. This is our powerhouse. So in our lymphatic system, if it picks up something, abnormal, it'll pull it to a lymph node. So lymph nodes are where everything kind of pools to. And then in the lymph node, it'll attack it. So if there's something, I don't like this, we're going to attack and clean it out and get rid of it. And then the last thing our lymphatic system does, it's a good transporter of hormones. So a lot of the different hormones that are running around our body, the lymphatic system will help with bringing it to different places. So those are the 3 top things that our lymphatic system does. It is so incredibly important.
So that's amazing. So how does it work though? How does our lymphatic system, drain everything? Does it do it on its own? How does that work?
Yeah, there's no heart to pump it, like you said, with the circulatory system.
Yeah. Our lymphatic system only moves via one way, and that is actual muscle contraction and movement that helps catapult the fluids. So our lymphatic system is like a one-way valve. And so, when we're resting, the valve is closed. But then when we have some kind of movement or muscle contraction or even massage, I didn't mention that, it'll open up the pathways and it'll catapult the fluid up where it needs to go. And so just like you had mentioned, our heart pumps our blood. We only can get the lymph moving via muscle contraction and movement or massage.
So where does it drain to? Like, I assume you have, your body rejuvenates new lymph fluids, and where does it drain to? Where does the old stuff go?
So everything comes back to the lymph nodes. So we have clusters of lymph nodes in our body. So the main areas we hold it are groin, our abdomen, our armpits, and then right above our collarbone. So we have hundreds and hundreds of lymph nodes. So everything will get pulled to the lymph node. And then from the lymph node, it usually gets picked up back up through our vascular system. And then our vascular system will then process the different areas. So it'll go to the kidneys and then we'll pee it out. It'll get deeper into our gut and then we'll poop it out. Sometimes it'll get processed in our liver. And sometimes, the lymph will just go back into the blood and it's just called blood. So our body is, I don't know, it's so incredibly smart. It just knows where to push it and move it.
The master recycling machine,
It
right?
is. That's exactly what it is.
Okay, but we have a problem. A lot of people in today's age are very sedentary. So we talked in our last episode when we were talking about breast health, how bras can constrict the breast, which then can lead to lymph buildup. I'm assuming the same thing can happen if you're not moving your body a lot. So what are some indications that someone may have some buildup?
Well, sometimes you can just see it visually, like the legs getting puffier. I give this example all the time, but you think of, grandma and grandpa that are in their 90s, then what do? They do a lot of sitting. Well, they accumulate a lot of times fluid in their lower leg. And I mean, obviously there can be other reasons for that, but it's because grandma and grandpa aren't moving as much. And so visual fluid filling is one thing you can notice. Sometimes people have you'll just feel like brain fog or just full or, a tightness, with an extremity or your abdomen. So, your body will give you kind of red flags that, maybe some of this fluid is a little stuck and not moving.
So then what can you do to intentionally keep your lymphatic system flowing optimally? You said movement, right? But are there specific modes of exercise? Is swimming better than biking? Because biking, you're kind of sitting and your legs are pumping and your upper body's not doing anything. Or is it really just any type of movement is helping?
Yeah, I think it's just, you have to move, period. And I don't care how you move. You've got to pick what you enjoy doing. So, I'm not a big biker, so I'm not going to pick biking. So, but I love, exercising my whole body. So it's really, I don't care how you move. You just have to move. It's just, do whatever makes you happy.
Yeah, perfect.
Okay, but then there's also, I'm thinking about in the fitness industry, which is Drea and our background, there are some movements that are a little bit more maybe loaded, meaning running has a little bit more of that bounce to it. Rebounding is a kind of a new thing that's really popular. Is this something that's recommended? And then if it is, what are some other tools that can also help accommodate this?
Yeah. Oh, you segued right into that one. That's perfect. Rebounding. Yeah.
Yes.
So rebounding is basically like a little trampoline, and you don't have to be a kid to use it. So just literally getting on and just bouncing. When you bounce on a trampoline, it literally activates every single cell in your body, and it really helps drive and pull and move the fluid out of, different areas that we don't want it. So, you don't have to, do the full out, you can envision jumping way up and down. You can sometimes just even get your ankles moving. So you're just doing a little bit of a bounce. So that is easy way to do it.
We just got a little rebounder for Christmas for the boys, and honestly, it was partially for me too. But how often do you recommend doing something like that?
I tell people find at least one time a day you're doing something like that.
Sure.
Where you're getting on. I like to, I'm spoiled. I have one in my clinic. So I have a rebounder and a vibration plate, which I'll talk about here in a minute. So I am constantly in between patients, or if I'm looking at my phone, I'm just going to go bounce a little bit on the trampoline or go on my vibration plate. So, I'm finding I always try to incorporate into my day, and I'll teach my patients that as well. Okay. How can we tie this into your regular day routine so it doesn't seem so like a chore to do?
Right. And it's not like you have to pull up a YouTube video and do the full out workout videos on rebounders because
No.
you can get crazy with those. And those are good workouts. But what you're saying, even just a little bit of
a bounce.
movements is just fine.
Yep.
So what are the vibration plates? You mentioned that.
Yes.
Yeah.
I love a vibration plate. Everybody should own a vibration plate.
I'm really curious about this.
Yes. I've done a lot of research on this, and, with my lymphatic background, I've had a lot of my individuals that have severe lymphedema go out and purchase this because it is such an easy tool. It's so passive, so what I mean by passive is when you go on a trampoline, you actively have to bounce. When you're using a vibration plate, you don't have to think about it. You just stand there or you sit there. And so you can use the vibration plate in so many different ways. Just like the rebounder, everything is moving and jiggling. So we're catapulting the fluid out of your body. So you can either stand on a vibration plate and you'll feel it like all the way head to toe. Sometimes patients that maybe do a lot of sedentary work and they're at their office, I'll have them get a little vibration plate and put it underneath their desk so they can put their feet on it. So it's vibrating their lower legs.
Oh, okay.
Or individuals that can't maybe tolerate standing on it because of, like maybe balance issues and safety issues. Sometimes even just laying down and putting a pillow on the vibration plate, and then they put their legs on the vibration plate. That's just another great tool to use as well.
When you're talking about the vibration plate, I'm thinking like in the 1950s or whatever, they had those like vibration, machines, but they had a different idea of like, this is how you lose weight.
Yeah. But actually they were onto something. This is pretty much basically the modern day version of that. So they were onto something. And I think they were, back then it was like to reduce cellulite and all that kind of stuff. But oh my gosh, the vibration plate does this similar thing. It really moves that lymphatic system.
Well, and I think people are constantly looking for less effort, more bang for your buck opportunities.
Yeah.
But this also makes me think about how valuable this could be for people, like you said, who maybe don't have as much mobility or balance, but like the older population that still needs that lymphatic drainage and just can't do it on their own anymore. Or even if, one of us who is in our 30s and 40s, like we got injured and we kind of weren't able to move as much. Maybe you broke your leg or something, like to have a vibration plate and be able to know that you're at least still getting some of those benefits, even though you can't move the way that you normally do for that short time period.
Yeah. You can definitely tailor it. I think it goes for like any age group, but I've seen it for the older population, like you had mentioned that, maybe are wheelchair bound or they just can't physically do a whole lot of moving and they're suffering from a lot of swelling issues. This is a great way that they can just put their feet on it and get things moving and changing for them. And they feel so much more comfortable.
Yeah. They should put that all in nursing homes.
They should.
Yeah.
Yes.
Wow. I've also seen you talk about sauna being beneficial.
Yes.
Let's talk about that. How does heat or warmth how is sauna? Is it the infrared? Is that kind of, or is any kind of sauna? Is it the warmth?
Yep. You want to sweat. Like that's kind of the bottom line. Our skin is the biggest organ in our body, and lymphatic fluid will flow out of our skin when we're sweating. Like sweating is part of what we have to do. That's how we can help eliminate toxins and the debris and all that kind of stuff. So just being in the presence of a sauna and you're sweating, you're actually moving that lymphatic fluid. So love a sauna.
Okay. I have a sauna at home. I go in like twice a week.
Yes.
It's amazing. So obviously you say any kind of sauna is good as long as you're sweating. Great. How about like the temperature, the length of the time you're in there? Is there anything about that?
I don't know research on like how long you need to be in there. It's kind of like, I tell people, do what you can do. Like we're all crazy busy. We all got lives. We got things to do. And I just feel like, designate what time you can. I think it's, especially in a sauna, you probably got to, be in there a little bit of length of time to actually sweat. Right. Yeah. But, just try to find that balance where you can designate this amount of time in there.
I love that.
So if there's anybody like me who really wants a sauna and it's been kind of like, is it a necessity or is it kind of more of a pleasure thing?
You can justify.
This is for our health, so we're just going to have to
vibration plate too. There you go.
Here's your excuse why to get it. What about other areas of our life? How can they impact our lymph health? So this doesn't have to do with movement, but like, does sleep or like your diet or things like that have any impact on our lymph health?
So when we get like really when we get a lot of congestion, a lot of times it could be an inflammatory response. So when we're talking the pillars of health. We're talking about, like diet, are we eating a diet that is really bothering us, creating a lot of inflammation, because when that happens, then it seeps out and our lymphatic system picks it up. So that can be a pillar. Sleep, that's a pillar of health. If you're not getting enough sleep, what are we doing? We're grabbing for the unhealthy things to eat. We have more stress hormones. So then it increases inflammatory responses there too. So you definitely have to, find those pillars of health. You need to exercise, you need to sleep, you need to reduce your stress. You need to drink water. That's the other thing too, is making sure you're staying very hydrated, because I have patients say like, well, I'm already got a lot of fluid on board. Why do I need to drink more fluid? Well, you have to help your internal organs flush all that, because when you drink lots of water, you're peeing it, right? And so that is how our body excretes a lot of those toxins. We're either peeing it out or we're going poop and we're pooping it out.
Mm-hmm. And you've also mentioned massage. So is there a difference between a regular, I'm going to go get a therapeutic type massage, and a lymphatic drainage massage? Is there a difference?
Yes, absolute difference. And so I'm lymphatically trained, so I'm a lymphatic therapist, and it is a very different technique than a massage. So lymphatics, there's a certain amount of pressure and movement that I'm trained on to help catapult and move the fluid where I need it to go. And a lot of times, we accumulate fluids in different areas, and it's really, that's the puzzle. That's what I love to do. I love to figure out why that fluid is stagnant and how we can get it moving. So it can be stuck anywhere in the body. We just have to figure out how we need to get it moving.
So do you offer lymphatic massages?
So I'm different than a massage. So I say it more lymphatic drainage. So I am more so not a wellness lymphatic therapist. I'm more of a very specific lymphatic drainage. So I'm kind of the individual that, okay, if you have a specific area of concern, whether it be your breast, whether it be your leg, whether it be your arm, I'm really trying to figure out why is that getting stuck and how do we need to get it moving.
Okay. And then just to dig a little bit deeper into this, when you're doing a lymphatic drainage massage, essentially, are you doing it in a methodical way to kind of pump the system toward the lymph nodes? How is the intention built around it to clear that?
Yes. Just like you said, I am focusing on getting it wherever it may be. I'm trying to steer it towards the lymph nodes, because that is ultimately where it needs to be. But if the lymph nodes are really stuck, then we need to drain the lymph nodes. So it's just kind of, like I said, reading the body and figuring out where you're stuck, and then trying to find pathways to open it up and teach you different ways that you can self-do it, or maybe modify different things that you're doing in your health that will help catapult that fluid out of that area we don't want it.
Okay. And just like in the breast health one, I want to hear, because you're the expert here, and obviously this is a huge passion of yours, and you want to make sure you're taking care of yourself. So in the lymph area of expertise, what are you doing for yourself? And then how frequently? You mentioned, you hop on the vibration plate as often as you can, and it's just short snippets between patients or whatever you can do. But what is your routine? I'm all about patterns. So getting in habit of doing this, and especially my lymphatic drainage, I time it around my shower, because you really, to do an effective lymphatic drainage on yourself, you have to be naked, right? And you want a little private setting. So I do all my lymphatic work in the shower. So I'm working on opening up the lymph nodes. So when I work with clients, I'm teaching them, different areas that we need to open: the groin, the abdomen, the armpit, up at the collarbone. So it's waking up those lymph nodes, which I do in the shower. And then I work a lot of my breast tissue. So I'm doing a breast lymphatic drainage in the shower when I'm in there. And then also to support the lymphatic health, outside of the shower, I'm doing rebounding, I'm doing vibration plate. I joined Hotworks, which is in Green Bay. It's a workout facility in a sauna. So I'm sweating and I'm exercising at the same time.
Ooh,
so
that sounds nice.
So I'm doing all kinds of things throughout the day just to help support my system, and drinking water.
I was going to say, how much does hydration play in this?
Yes.
Huge. Yep. I don't have it today, but I have a big thermos or a big cup that I just sip on throughout the day, and I'm really trying to keep my body hydrated throughout the day.
How long does it, if you're in the shower, obviously you shouldn't be in there for 20 minutes, but how long does that take for you to do?
It does not take long. Yeah.
Okay.
When I think initially maybe as you start getting like, oh, how do I do this? It might take a little bit longer, but I'm telling you, as I've been doing this for years, so I can do my whole lymphatic routine in under, probably 3-4 minutes.
Okay. So it doesn't need to take long.
No.
That's what we need to tell people.
Yep. It does not take long.
And I'm sure people, like you said, they're kind of like, how do I actually do this? Where do I start? All that stuff. But you do have a free guide to a healthy lymphatic system on your website. So what is that?
So that, when you go to my website, it automatically pulls up and you can get it emailed to you. But it just really kind of talks about the different, I give education about the lymphatic system, and then I give you tips on how to get the lymphatic system moving, and then, talk a little bit about lymphatic drainages. And then that's kind of what I do.
How awesome. You're such a great resource in our area. And then you also do offer lymphatic evaluations, and that's in your office?
Yes, that's in my office.
What do those look like?
So that is for individuals that do have those areas of concern, whether the doctor has told them or they can feel it themselves. And so, it's just like a mystery. I love like listening to your history, why is this being congested? What can we do? And so it's really evaluating, both listening and doing hands-on assessment. And then we really dive in deeper, like, okay, how can we specifically get your lymphatic system moving? Where you're stuck, what can you do? What lifestyle changes can you do to get that lymphatic system moving better? And I've seen amazing changes with my clients that, they're really getting their lymphatic system up and moving and cleared.
That's amazing. I want to do all the things.
Yep. I think I'm going to be ordering a handful of expensive things pretty soon because they're needed for my health, obviously. So this was a great conversation and so eye-opening. I mean, this really isn't being talked about enough. So we appreciate you being an expert that's local in our area. People can obviously reach out to you if they have more questions. What is the best way to contact you?
Definitely hopping on my website. So Uplifted Oncology Rehab. I have a contacts tab. So if you click that, you can fill out the form there. Otherwise, my phone number is available on there too. So feel free to call, text. Be happy to talk to you on the phone. I do a lot of phone consultations if you just have a lot of questions.
Awesome. And then we do have one more episode coming up. And we're gonna hit the topic, and doesn't matter how gross it feels to you, it's important. So we're gonna be talking about poop in our next episode. Questions that are common, honestly, that a lot of people are asking and nobody's really talking about. Like, what should it actually look like if it's healthy? How often should you be going? What are some signs that your gut health might be out of balance? What can you do for constipation? These are all questions people are constantly asking for themselves and or their kids. So we have that one coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.